Today, we'll be talking about Parkinson's disease from the perspective of Oriental medicine. We consider that Parkinson's disease is characterized by internal wind. So the thing is actually related to its primary symptom: tremor, rigidity, and slow movement. These three are very important symptoms for Parkinson's disease. The tremor in Oriental medicine, we consider that as kind of a wind-related symptom. In 黄帝内经素问, it is said wind tremors are due to the liver. So the tremor result from the wind are associated with liver. Wind tremors are due to the liver. Why is that? Because wind is wood, liver is wood, right? Based on 5 elements. And the wind is very commonly seen pathogen. And the wind is yang wind as one of exogenous pathogenic factor. This is a leader. We consider wind is the leader of all exogenous pathogenic factors. It can guide cold or heat or dampness to invade the body. And then wind, the nature, is characterized by rapid changes. And wind is yang pathogen, and it invades yang position. Yang position means upper parts or superficial. Wind is yang, and it is with the tendency to transform into heat or fire. And the last one is wind is characterized by constant movement. So we just briefly reviewed the wind, and combined with our topic, we are talking about the tremor. Okay, Parkinson's disease is kind of what? Tremor, thinking about that. Head, body, and even hands. So there will be a very significant symptom for wind as we're talking in this topic. From the perspective of Oriental medicine, Parkinson's disease is tremor. The tremor is related to liver, is related to sinew, is related to internal wind. That is not external, that is internal wind. And it causes fire, even gave you the phlegm, dampness, heat. Also, you can use some other, for example, diet, emotional triggers, overwork, etc. So any causes if there's malnutrition or if there's not nourishing tendons or sinews, then there will be tremor. And then we consider that is liver related. Let's say the internal wind. Tremor is a primary symptom of the Parkinson's disease. And also there will be rigidity, and bradykinesia, slow movement. And liver controls sinews, or we use different terms, tendons, right? So thinking about this is the main mechanism as we're talking about Parkinson's disease in this lesson. What we should emphasize is actually sinews, tendons, and then the internal organ is associated with liver. And we know that it's internal wind. So if we want to set up a treatment principle that makes sentence with those three words, liver, wind, and tendons. So the treatment principle for the Parkinson disease is soften liver and nourish tendon and use the verb extinguish wind. Try to use these three words for the treatment principles. This is internal wind. So with this treatment principles, we try to focus on this aging with the understanding of Chinese medicine. We know this is related to brain, liver, because based on the Western medicine symptoms, you can understand there will be some other what? Cognitive dysfunction. Also, there will be some psychological, emotional depression. So there will be. And also there will be some spleen and stomach related problems. Constipation, indigestion, etc. There might be some other heart related insomnia, etc. So we have not only this liver and brain, we can consider this brain because this brain is the marrow, C, right? Brain is the C of the marrow. And also we have this food and earth related problem. So we have this spleen, stomach, brain, liver. These three are mainly associated with Parkinson's disease from the perspective of Oriental medicine. So try to follow the therapeutic strategy softening liver, nourishing tendon, extinguishing wind, then we can find or we can make the acupuncture points prescription like this. So we have main points for the brain, but mainly we can understand it is aging related. So marrow seeds. And again, this is kidney, right? We have local points. We have local points, 220, Baihui, and Shen Cong. These are points located in the vertex. And acupuncture, these 2 points can waken the spirit, also can calm the spirit. And then we have gallbladder 20. And then we have gallbladder 34. Then we have large intestine 4 together with liver 3. So we have these points as main points for Parkinson's disease. Parkinson's disease is internal wind that is due to liver dysfunction, and the liver controls tendons or sinews. We have a specific point, which is one of the 8 Hui influential points, this Yanglingquan, gallbladder 34. So here, it not only can regulate gallbladder qi and the liver qi, because gallbladder is internally related to liver. So we have liver 3. Liver 3 together with this gallbladder 34 that is widely used for qi stagnation, especially liver qi stagnation. But here in our topic, Parkinson's disease, not only for liver qi and gallbladder qi, because this is tendon, sinew, influential point. So here we have tendon here. We have this liver 3 and large intestine 4. This is a 4 gate. 4 gates. So we know open 4 gates. That is 2 pairs of large intestine 4, Hegu, together with liver 3, Taichong, and those 4 points together we consider as the 4 gates of qi and blood. So combined with those 4 points, we consider opening 4 gates to move the qi and activate blood. So that is for the qi and blood circulation. Also, we can use this for liver qi stagnation and blood stasis. And then we have a very important point here. Gallbladder 20. The gallbladder 20 is not only located on the gallbladder meridian, it's quite near to the head, but that is not local point. That is because this gallbladder is widely used for wind pattern. So the name of this Fengchi is wind pond. Thinking about the wind, that is for wind pattern. Okay? That is for wind pattern. Also, this Fengchi gallbladder 20 belongs to Yanglingquan channel and Yang Qiao channel. Yang Qiao channel and Yang Wei and Yang Qiao channel. So the Yang Qiao channel is actually related to movement. Why we use this gallbladder 20? That is Yang, not only Yang Qiao, but also Yang Wei meridian. Thinking about this disease, Parkinson disease is motor or movement related, not only tremor, but also slow movement and rigidity. Rigidity, you can understand with lack of lubrication in meridians, body fluids, blood. You can understand with that. It's kind of rigidity, lack of lubrication, something like that. But for the movement, you understand based on yin-yang theory, yang movement belongs to yang, and staying still belongs to yin. So for the movement, we will select yang meridians. And you know, this yang qiao is for movement. And this gallbladder 20 is one of the points of yang qiao meridian. So it can regulate the yang, regulate the movement, not only for all types of wind patterns, but also it is located yang qiao. Think about this as a kind of movement. Lever 3 is yuan source point. We can regulate liver, nourish liver, because this is a yuan source point of liver. Together with large intestine pole, we can nourish liver, yin and blood, and regulating liver qi, open the four gates, move the qi, and remove stasis. So these are the main points for Parkinson's disease. And thinking about the brain, that is related to cognitive dysfunction. And we put this brain here because we have local points here. I use this color. So we have local points. Do 20 Sichong. It can awaken the spirit and it can calm the spirit. So we have this main points for this.
In summary, Parkinson's disease is characterized by internal wind. The treatment strategy is to soften the liver, nourish the tendons, and extinguish wind. Thank you for watching. For more lectures on traditional Chinese medicine and acupuncture, please like, subscribe, and follow Authentic Traditional Chinese Medicine.